Good morning, everybody. Thank you so much for joining us for our coffee conversations today. Today, we are going to be talking with Dondra Goldsby about toxic positivity. A lot of people don't know that this is a thing, so we're very, very happy to have Dondra here to talk with us about what it is, about how it affects people, and ways to kind of navigate through it. So welcome, Dondra. I know that this is your second time back to Coffee Conversations, so catch us up, tell us how you've been, new things going on.
Yes, I'm so excited to be back. Yes, my first experience with the coffee talk was the one on boundaries with breast cancer. And man, this pandemic is going on. A lot is happening in the world, but all is well, truly blessed. Everything is going okay. So I'm just chiming along with continuing in practice as a licensed marriage and family therapist, seeing my clients, hanging out with my family, enjoying every day.
Yes, all you can do is enjoy, one day at a time. You can't think too far ahead because, we don't know what's going to happen.
At all.
Um, yeah. So in light of just, everything going on in the world, we always do our best to stay positive and to stay in a good mindset and to try to always look at the good things. But in reality, everything isn't good. In reality, there are times where you're going to feel sad, you're going to feel frustrated, you're going to feel mad because certain things are happening in life. And sometimes when you see somebody going through something, you're like, let me be a positive person. Like, oh, it's going to be good. Don't worry about it. It's all going to work out. And all of these other different things. And sometimes that translates to toxic positivity. So could you kind of tell us a little bit about what is toxic positivity and in what ways is it harmful, or does it minimize what somebody is experiencing?
So toxic positivity is a whole thing, to the extent that as I was thinking about preparing for this, I gave it the abbreviation of TP. Toxic positivity, in my opinion, is positivity that hurts. It's the words that we use that are poisonous, harmful, unpleasant, destructive, unsafe, that cause injury, that do the exact opposite of what positivity is intended to do.
So in what ways, and thank you for that definition, by the way, but also, in what ways can that positivity like affect somebody? Like, can you give an example of, a way that toxic positivity can hurt somebody?
So I found a definition. Well, it wasn't a definition, it was a quote. So let me read this because I think this speaks to the question. There is a fine line between giving someone support to help them feel optimistic and offering a level of positivity that is mismatched to the situation that someone is in. And that's by Jody Samara, who's a clinical psychologist in Vancouver. And that really stood out to me because I think that that is what's happening. There's a mismatch between the person's intention, because, I'm always assuming goodwill. And so I'm assuming they mean well. However, it's not coming across that way. It's causing injury. It's causing the person to feel unsafe, unheard, and possibly minimized in what's going on with them. It's discouraging because it makes people feel invalidated. And on its worst, in the worst way, it can make people feel really judged and really shamed.
Yeah, and I think that speaks a little to why it's important to recognize whether I am being a positive person, I'm being a positive resource to this person, or I'm just trying to gloss over what they're going through, because that's what it ends up feeling like. Like if I'm telling you my car broke down, I don't have money to get it fixed, I gotta go to work because I'm on my last strike, and you tell me, don't worry about it, it's gonna be okay. That is a little bit toxic to my crisis right now.
Yeah.
So could you give like an example of what something like that would feel like specifically for the breast cancer community? A lot of times people may not know, what to say. So what are some things that you've heard or, you've seen someone say to somebody in the breast cancer community that might be a little bit toxic, even though they're trying to be positive?
Right. So I sure can. I have a whole list of them, which I'll give you in just a moment. I was looking at just some synonyms that go with positivity from the Oxford translation. And I think it's what people's intention is when they come in and they are kind of leading with this toxic positivity. I think their intention is to be useful and productive and helpful, that what they're saying is beneficial. I truly believe that most people, when they're engaging in toxic positivity, they're thinking, man, this is going to be really helpful when I share this with this person. And it's everything but that, but that's what their intention is. They're thinking this is going to instill hope. This is going to be effective. And I think that all of those are the filter that you run it through before you say the thing. Like, is this helpful? Is this productive? Is this going to be useful? Is this going to help this person feel encouraged, or did I just place a burden on them? Like when you're trying to decide, what should I say? What shouldn't I say? And I just want to say this, wanting to help people and help people feel better, especially when you know that they're going through something, there's no shame in that. That is not a crime. But here's the reality. Breast cancer patients and breast cancer survivors have walked through some fires that you know nothing about. And even if you've actually had breast cancer before, your experience is going to be different. We are all physiologically unique, and all of the cancers are different. And so one person may have an aggressive type and one person may not. One person had chemo, but the other person had radiation. One person had side effects and complications from surgery, and the other person didn't. One person has a ton of support and the other person is walking through it by themselves. And I'm just gonna, yes, throw in a plug for Forge. They may need to call you. They may need to have you set up some transportation for them because they can't get to and from their treatments and they don't have anyone else to help them. And so when someone says, oh girl, I had this, you're gonna be fine, you just wanna make sure that you're not coming in hot and really invalidating a person's experience or making a person feel like, well, gee, maybe I should just be grateful. Maybe I should just find something to be happy about, because you get to be in a funk about having something that sucks. Like, it's not anything, that's the line that nobody wants to be in. And so you just want to be careful when you are trying to instill hope, but that's not what's happening. So before I give the examples, did you have any questions or comments, Janita?
I think that everything you said is just like really awesome, especially, about the part of invalidating what they're going through. That is so huge because oftentimes when people are talking about, this is my experience, this is what I'm feeling right now, and you just tell them, but I mean, you could be going through this. Or, you got to be grateful because at least it's just this. That's the worst thing to say because that's not their reality. The reality is that I have breast cancer and this is affecting me in this way. And you have to allow that person that space to feel what they feel. So I love that you brought up, don't invalidate somebody's experience, especially when you think, okay, well, if I let them know it's not as bad as it sounds, they'll feel better, when in actuality, it's not, because it's still bad from where they previously were before they got this diagnosis.
Exactly.
So those are my comments on that. That is so important. To make sure that you're not telling them, well, compare your situation to everybody else's, because if you look at your situation, it's not as bad as this, or you could be this, or you could be that. So yeah.
Exactly. And before I give you some of the examples of things that we're not going to say, if we don't want to engage in this toxic positivity, I want to say this. There's lots of, you're going to be fine. It's going to be fine. There's lots of, once you transition from being a patient to going into survivorship, the assumption is you're fine. We got it. It's all gone. Everything is okay. Well, let me tell you that being okay looks different after you've had cancer. It's not and erase it from your memory and never think about it again. Because here's the thing, while there are a lot of women who never have a recurrence, any woman or man who has had breast cancer is at risk of recurrence. It may be low, but that risk is still there. And part of your being okay and moving forward is, what's your bandwidth for tolerating what your percentage is. Some people's percentages are higher than others. And so when you're like, you're fine, everything should be okay, that's not exactly true. That's still something that you have to face and deal with. And you have to decide, how am I going to deal with the scan anxiety, of the living from scan to scan, because that's a real thing. And people who aren't in that and living that, and that's not their reality, they don't always understand that. So here's some things that I would highly recommend that you not say if you are not wanting to be accused of toxic positivity. It'll be fine because you don't know that. At least, because this is what I call hope by comparison. I'm hoping that my situation is a little bit better, that I don't have to be in fear because at least I don't have this. Everything happens for a reason. I have yet to hear a good one for why people get breast cancer. So like, that's really not helpful. And let's just flip it on its head. If it's your child that gets cancer, tell me the good reason for that. There's not one. That doesn't work. Well, so-and-so had cancer and they're okay. Just no. Well, you got the cancer. No, you got the good cancer. Now, if your doctor's telling you that and they're telling you that means your treatments won't be as intense, that's one thing. But anybody that's in your support circle that's saying you got the good cancer is, they're probably not as in touch with reality. But it was God's will. Maybe that's your belief, but don't speak that over me and make that my reality, because what God is that's doing that to people, zapping people with cancer for what reason? At least you didn't have a mastectomy or chemo or radiation. At least you got a good boob job or a tummy tuck or a butt lift. But didn't we already talk about not saying at least? Because here's the thing, the person who had to have any of these procedures because of the loss of their breast would not have wanted to have that in that way. Probably could have gone their whole life without having to have these procedures. So it's not a benefit, it's a restoration of what cancer took away from you. And that's totally different than just a regular butt lift or a tummy tuck. You're so thin. You may have good intentions when you say that, but usually if you're dealing with a person that's experiencing cancer, they're thin because they have a poor appetite, because they're not feeling well. That's not the intended way that they will go about losing weight if they wanted to lose weight at all. Also, more things not to say. It's just hair, it'll grow back. So then my question would be, so do you want to shave your head to support them? No, you don't. So it does matter, right? We just really got to think about what are we saying to try to smooth things over for people. Also, when people talk about their side effects from medication, and some of the groups that I'm in, people will say, man, these side effects are so bad, I almost want to stop taking them. And then they'll get feedback, well, the medication side effects are better than having cancer. Not necessarily. Two things can be true. That cancer is an arduous journey and is very difficult. And some of these medications are hard on the body. And so you don't have to pick like, well, because they got the cancer, then I guess I'll just not complain about these side effects that make me not be able to walk and make me not be able to work the way that I used to. That's not necessarily true. You should try this. I don't know, for those of you who are listening now and maybe listening in the future, we could probably write a book on the amount of advice you get on nutrition. Well, try this and try turmeric and try eat soy, don't eat soy, do these things. None of this coming from the medical professionals, but the people who are trying to help. God is just trying to get your attention. Just keep in mind that now you just blame the patient and you may have just added to the spiritual doubts that they're already having. And then just a don't for a metastatic breast cancer patient, well, at least you know how much time you have left. Just why? Why would you say that to anyone? Okay, those are the don'ts, Janita.
Those are some good don'ts. And I see some of the chat popping up too. And they're like, yes, I've heard that one. Yes, don't say that. And a lot of it is, what I'm hearing is a lot of it is a comparison. And that is very unfortunate. A lot of times you can be in a group of friends, you can be talking about this happened in your day. Well, let me tell you about my day because it was 10 times worse than yours. And that's exactly what it feels like. It's like you're saying what I'm going through is not as much because I should be grateful that's all that I went through. But you don't even know what that means to me and how that makes me feel. So those are some great don'ts. And if you're saying them, stop.
Please stop.
Stop saying that. Don't say that to people because it doesn't really help them. Like you said, I love that you pointed out that it can create some more spiritual doubts I know we did a coffee conversation on balancing breast cancer and spirituality. For those who are more spiritual, they can get really mad with whatever their religious base is. Like, I've been faithful and I've been doing my best to live by whatever it is that they identify with. And even still, I've gotten this thing that I need to live with and navigate with. And telling them that, well, God said that he's trying to show you something. He's trying to make you this or do whatever, however they want to word it. It doesn't help all of the other situations that that person might be going through. So I think that's super important to point that out too. Like, probably telling people that the worst thing to happen to you is God's will is not helpful. It's not.
Right. And to further your point, we also then make the mistake in our well-intentioned way of pulling out the wrong scripture, the one that makes the person feel bad for even having any fears or doubts, as opposed to maybe pulling out the one, and I don't know where it is. I'll have to look it up and tell you later. But instead of pulling out the one that says God is near to the brokenhearted, something that expresses empathy versus something that makes a person feel worse than they were already feeling.
Mhm.
And so my goal in doing this is not to admonish, because again, I do think people mean well. And just know this, if you are the loved one of a breast cancer patient or survivor, they may not call you out. They may not tell you that they don't like this, but if you want to do better, here's an opportunity to really start to think about it differently. Sometimes we just say things because that's what we've always said, but here's an opportunity to do something different. So my goal is to help educate you if your intent is to not cause harm with your words. So here's some options and some things that you might want to try. I don't know what to say. It's a whole vibe. I don't know what to say, and then be silent. I'm here for you. I cannot imagine how difficult this must be for you, because that's fact. You cannot imagine how difficult it is for them. And so don't try. Don't fill in that space. Sit with your own discomfort of, I'm hurting with you. Cancer sucks. It's okay if you don't know what you need right now, but can I check back with you? And I say that because sometimes when you're overwhelmed by what you're trying to get out of your body, by the side effects of what you're trying to do to take care of yourself, you're not in the best headspace to say, gee, it would be nice if you could pick up groceries, or could you take my dog to the vet for me? But just letting them know, it's okay if you don't know now, but is it okay if I check back? And always check, because what you think might be helpful might not be helpful. Because again, you want to think about the patient or the survivor and what's in their best interest and what's helpful for them. So if you want it to land well, then make sure it's about that patient or survivor. Saying, I'm listening, saying, I support your decisions, and meaning it. Not giving people pushback because they didn't treat their cancer in the way that you would have treated it if it were you. Just give them some support, saying, I'm available to help you with your recovery, and then be available. Like, I hope you're getting the vibe. Don't say things that you're not going to do. So if you say, I'm listening, listen. If you say, I'm going to support you, support. When you say, I'm thinking of you, that's a really kind thing to do. And I tell you, there's some truth to that. People can feel when you're thinking about them, loving on them, praying for them. I've heard so many people say, I can feel that. I'm sending love your way. You don't have to do this alone, because when you're facing such a really scary situation, you do feel alone, even if 100 people are around you. But just reassuring them, you are not alone in this. So that's what I got tonight.
Yeah, yeah. And I'm sure like that list gets longer and longer.
Yeah.
Because I mean, there are always ways that you can show your support to somebody, and actually be supportive versus, and it's okay to not know what to say. And I say that all the time. It's okay to not know what to say, and to say that. People will respond better to, hey, they don't know what to say to me, but they want to be here for me, and they don't want to say the wrong thing to make me upset. I know I've used that a lot in life. Like, I don't know what to say. How can I help you though? Do you need me to bring you some food? Do you just need to call and vent? Do you want to ugly cry on the phone? Like, how can I help you? And not say, anything that necessarily compares, or just not even necessarily false hope, but they're just not in that space, and just kind of respecting where they are in their journey, meeting them there, how can we walk through this together instead of, well, let's just jump over the hard part and just get positive and we're going to get through this. But that's not the reality. Like we can only take things one day at a time, one moment at a time. So you can't really skip over the negative because it's uncomfortable. And I think that's where that toxic positivity comes in, where they're just like, well, that definitely sucks, but at least, this is great. Let's just skip over that because that's uncomfortable. We don't want to be dark and gloomy. Let's just go ahead and skip and be happy. And unfortunately, people, that not only is that a bad thing, but also people don't recognize that that is exactly what they're doing when they are trying to peer pressure somebody to be a bit more positive about their situation when they're not in that space yet.
I love that you said peer pressure someone into being in that space, because it's almost got that energy or presence of, come on, pep up. Like, I need you to get in a better headspace around this. And that is not what's helpful when you're a survivor, as a survivor. And to people who've come to me since and have let me know, hey, this is what's going on with me, I can tell you there's some value in being intentional. When people say, hey, I have to go have this test, or I have to go have this procedure, something as simple as put that reminder in your phone. And that night before or the morning of, hey, I'm thinking about you, I hope that this goes well. That goes a long way. That really goes a long way, because they know somebody was thinking about me today as I get ready to go do this hard or difficult thing or this uncertain thing. It just goes a long way. The less you say with quality, with value, the better. Because sometimes, again, going back to that quote, sometimes we are saying something just because we need to say something, not because the something that we're saying is helpful. And that's just how some people deal with their anxiety. But this is an opportunity to figure out a more helpful way to channel that so that you're not causing harm to someone who's already going through so much. And so what I would recommend for people to have 3 points around how you can best stay out of toxic positivity if you're the patient or survivor, or if you're that loved one, family member, coworker. The first one is practice awareness of how you really feel without judgment. Feelingswheel.com. Look it up. There's a ton of feelings on there. And if you look it up, you'll probably realize you've run the gamut of a lot of them, and all of them are okay. It really is not judging yourself of, I should be more grateful, or I should feel this way, as they call it, shoulding all over yourself, which is shaming yourself for how you feel. And for the person who's the supporter, you get to have a whole range of feelings as well. You just should not dump them. It would be better if you did, not should. It would be better if you didn't dump them on the patient. It'll be better if you kind of had that, got yourself grounded before you come to them, because they really don't need all of that from you. But it's okay for you to have your feelings as well. The second thing I would say is accept that feelings give us information, because they do. They don't have to drag us around and run our life. I kind of think of feelings like that little toddler when company comes over. They come out of the room. They're like, look at me. I can dance. I want to sing. I want to say the thing. And you're like, hey, no, we're talking. We have company right now. Let them do the thing. Because once they sing the little song or tell the little joke, what do? They go on about their business. And our feelings are kind of like that. Let the feelings come. And again, not shaming yourself. So let's just say you're struggling and you hear someone else got clear margins, but you didn't. Someone else score said chemo wouldn't be beneficial. They don't have to do it, but now you've got to use the red devil. And so jealousy comes up. So what? Doesn't it make sense that you don't want to be in that percentage that has to do something so hard and painful? You don't have to feel ashamed about that. But you also don't have to become bitter about it and let that drag you around. For me, my professional and personal solution to how to deal with things that we don't want to have to deal with is to ask myself, how do I want to be? Not what do I want to do or what do I want to feel, because I can't control what I'm feeling and I have yet to figure out what I want to do. How do I want to be? Well, I want to be humble. I want to be gracious. I want to be kind. I want to be supportive. I want to be helpful. I want to be as joyful as I possibly can. Joy being something internal, not externally based on your circumstances. That's how I want to be. The third thing that I would recommend is acknowledge you're in a season. Breast cancer patient or survivor, you're in a season. family member, you're in a season. It's difficult, it's uncomfortable, it's unsolicited. Nobody asked for this. Nobody did anything to cause it. So get those thoughts out of your mind. It happened because things happen that we don't want to happen as part of the price of admission of doing life. We don't always have the answers, and sometimes answers don't help. And so just normalize everything that comes with being on this part of the journey. Give yourself some grace as the patient or survivor. Give yourself some grace as the family member.
Thank you so much, Dondra. I feel like we could talk about this for so long. I just love this topic, and I love the things that you've been saying. Additionally, to the things that you've recommended, do you have any final thoughts that you'd like to leave our listeners with, those who are present and those who might be listening later?
Absolutely. And I want to thank y'all for showing up for this conversation. I want to encourage you to recommend it to someone if you think it will be helpful, because that's the only intent for showing up, is to help people do a better job of showing up. Because I, again, truly believe people want to be there and they want to be supportive, but they also, just like it may be your first time having breast cancer, it's their first time trying to figure out how to be there and be supportive for you in the diagnosis and in the recovery process. So my final thoughts would be this: a diagnosis of breast cancer leaves the patient and their loved ones feeling speechless. Many people don't know how to feel, and a lot of people don't know what to say. Sometimes people ignore their feelings and they just start saying things. They're just really overwhelmed by their feelings because they want to fix the situation. However, remember this: the wrong thing spoken at the wrong time is unhelpful and it can be hurtful. So take a beat, take a breath, gather yourself, take another breath, and then move forward knowing that you're about to engage with a sacred soul that's fighting for their health and that's fighting for their life. So proceed with caution, but most importantly, proceed with love.
Thank you so much, Sandra, and I love that, especially that afterthought. Like, even though you're taking a breath, take another one, just in case you're not ready still. So thank you so much, Sandra, for joining us today, giving us all of these awesome tips and really clearly defining, or more clearly defining, what is toxic positivity in ways that you can kind of change how you navigate a conversation when trying to support someone, especially those with breast cancer. Thank you, everyone who attended the call today, and we will see you all again soon. Thank you so much.
Thank you.